Hi, everyone. My name is Dean Robinson. I'm an associate professor of political science at the University of Massachusetts Amherst. I serve on the board of MassCare, which is the single payer coalition here in Massachusetts. And I'm going to make offer some remarks on Medicare for All and racial justice, taking a bit more of a historical and political economy perspective. I want to make 2 points. That Medicare for All advances goals associated with the Black freedom struggle, or what was called the Black liberation movement by the end of the 1960s and early 1970s. And for most of the 20th century, this meant securing broad social and economic rights, including the right to bargain collectively in full employment, as well as robust anti-discrimination law and policy. Hamilton in their book, The Dual Agenda, and Ture Reid and Toward Freedom both get at this history in slightly different ways, but here again is the idea. From the New Deal period until the waning stages of the civil rights and Black power eras, it was the consensus view across the ideological spectrum that advancing racial justice meant universal social welfare policies, including healthcare. It meant economic rights, including collective bargaining and full employment, as I mentioned, and it meant federal hegemony over all of this. And it was universal policies that were thought to provide the platform through which we would then address racial and other forms of discrimination. This is an underappreciated history because of a false assumption, and that is that the civil rights movement and concerns about equality for Blacks in the United States focused principally around racial apartheid and discrimination. And this was never entirely the case. A. Philip Randolph, Bayard Rustin, Martin Luther King Jr., and other civil rights activists across the political spectrum viewed the status of Black Americans as linked to more general dynamics of inequality under US capitalism. Therefore, the only way to secure benefits for Black Americans was to win them for everyone. And this perspective could be seen, for example, in this 1944 publication, What the Negro Wants, edited by Rayford W. Logan. Same types of assumptions guided the March on Washington and the slogan, Jobs and Freedom. This march was orchestrated to give support to the Civil Rights Bill that was signed into law in 1964, but it was also in support of economic rights. First released in 1966, the Freedom Budget also captured this idea of a dual agenda of advancing universal social and economic rights, as well as laws and policies that target racial discrimination. So in the Freedom Budget, you can read proposals about a federal jobs guarantee, basic income guarantee, as well as universal health care. And even radical groups like the Black Panther Party saw racial oppression in the context of US capitalism. And so for the Black Panther Party, Black liberation required federal provision of a range of what we call social welfare items, as well as healthcare. And in addition, it required tackling racial inequality that was due to specific forms of racial oppression. The picture to the left shows the Black Panther Party's free medical program for members of the community. So again, the point here is that there was broad consensus across a range of activists from the 1930s into the late 1960s that we need to aspire toward universal social welfare provision, broad economic rights, as well as targeted proposals and policies that address racial discrimination. Now, when we look back, this dual agenda idea was correct. When Black people enjoyed greater economic, social rights, health got better. Next slide shows how that's so. This comes out of a book project that I'm doing with a friend and collaborator, Javier Rodriguez. So here you're looking at excess deaths among Blacks under 55 years of age. This is capturing death rates above what should have been expected if Black people were dying at the same rates as their white counterparts, adjusting for sex and age. Notice that the slope is downward, and we estimate that the racial disparity would have disappeared by 2004 were it not for the Reagan Revolution. So why did racial health converge? Why the racial health convergence? Well, there was a broad set of policies that were enacted during this period. So we'd look at the war on poverty, which had a number of anti-poverty programs, but it also led to expanded public sector job opportunities that were especially beneficial to Black women. This was a period of civil rights laws that formally ended racial apartheid. This was also 1965 when Medicare and Medicaid were enacted. This, of course, expanded healthcare access, but Medicare also pushed a swift desegregation of American medicine by being able to force hospitals and clinics to comply to Title VI of the Civil Rights Act. So again, by pushing broad economic, social policies as well as anti-discrimination laws and enforcement, we saw a dramatic improvement in the health of Blacks relative to whites. So of course, this changes, as you can see, with the election of Reagan in 1980 and the social and economic policies that then follow. You see that excess death rates for Blacks increase very dramatically, and then they begin to fall in the period that corresponds to the Clinton administration. I want to point out that in the work that we're doing, we're finding that it's not that there were positive governmental programs or policies that pushed this convergence of Black excess mortality relative to whites, but it's rather that white health was declining, and that's believed to be due to the deleterious impact of trade policies like NAFTA and GATT on employment at the time. The thing I want to emphasize here, and it's a kind of obvious point, is that when we think about racial disparities then or in the present context, this has nothing to do with mysteries of DNA. This has everything to do with trends in political economy and in social and economic policy and anti-discrimination enforcement. So Medicare for All can advance racial justice directly by providing healthcare access and quality. Medicare for All is a way to guarantee healthcare as a human right, and we can use the power of a single payer to enforce compliance with anti-discrimination law, as we've done in the past. And we can thereby ensure that healthcare is delivered in an equitable and appropriate fashion. Medicare for All has an indirect impact on racial equity in that it bolsters wages, which are affected by rising healthcare costs, as well as relieving public budgets. So whether you're talking about towns, municipalities, or state government, Medicare for All relieves public budgets, and that is going to disproportionately benefit Black and brown people who tend to rely on not only public programs, but public employment. And so again, they're indirect ways that Medicare for All advances racial justice. We have a lot to do. We need to really push this within our unions and engage in broad community and public education campaigns. And of course, we have to advance the goal of Medicare for All at the state and or national levels. And so, again, I wanted to offer a historical overview, a kind of political economy overview about the importance of Medicare for all in advancing racial justice. And I will end my brief remarks with a quote from the Black Panther Party: all power to the people. Thank you very much.